much, Ursula. So good morning, everyone, and welcome to the Dental Health Services Victoria Public Oral Health Innovations Conference. This conference is now in its 7th year and has become a significant event on our health calendar. We launched the annual Innovations Conference because we wanted to provide an opportunity for people working in the public dental sector to come together and showcase their great work and inspire our colleagues. One look at today's agenda and you can see how this event has expanded to include a diverse lineup of expert speakers who are at the forefront of transforming the way we deliver healthcare in Australia and internationally. My task today is to introduce the conference theme, Evidence Matters. If I had to give a one-sentence answer to the question, why does evidence matter, it would be this. Evidence tells us how the healthcare system is working and not working and empowers us to make it better. That's why I can't think of a more suitable theme for today, given what's happening in the oral health sector at the moment. At Dental Health Services Victoria, we are in the process of using the principles of value-based healthcare to transform the way that we design and deliver oral health care. Our new system is patient-centred and co-designed with consumers. And I think it's really important to pause and think about whose evidence we use, and that consumers provide us with extraordinary evidence. It ensures we provide the right services by the right person in the right location, and it focuses on integrated care that no longer treats oral health in silos. Why the change? Because the evidence tells us that what we've been doing isn't working. We've known for a long time that we need to move away from drill and fill approach to dental disease and focus on prevention and early intervention. That requires us to understand and address the social determinants of oral health, to develop new interventions based on the available evidence, and where there's a lack of evidence, to lead the way in creating it. Right from the beginning, our move towards value-based healthcare has been driven by evidence. We looked at the Harvard model developed by Porter and Lee and adapted it for the public oral health sector. We analysed variations in oral health care across the world, across Australia and across Victoria. And what we found was pretty startling, with extreme variation in the types of treatment and interventions being delivered. We also looked at the body of evidence linking oral health to general health, and we spoke to consumers about the health outcomes that matter to them. Everything we do starts with evidence, and everything on today's program is as a result of evidence. While we are making great strides, we are at the beginning of a huge transformation. We have a lot more to learn and a lot more improvements to make, particularly in the way we use the data we collect. And while we collect a large volume of day-to-day data, we need to find better ways of analysing, prioritising and communicating that data that facilitates continuous improvement. This will help us reduce the variations in care across the state, as well as variations in care from one cubicle to another. At the moment, we're focusing heavily on patient-reported outcome measures, and you'll hear more about that from Shalika Hedge later in proceedings. Sue McKee and Aisha Mansfield will also share our progress in implementing value-based healthcare in Victoria, and I'm sure you'll gain some great insights from that presentation. As I mentioned before, there is another key reason that this is such an exciting time for us in oral health sector, with the state government committing $395.8 million to provide free dental care at Victorian schools. These funds will be used to bring back school dental vans over the next 4 years, making oral health care more accessible and affordable for Victorian families. Last weekend, we held our first co-design workshop with children and their parents to help shape the school dental van program. Children engaged in a series of activities to help us understand the type of service, communication methods and equipment they'd like to see or not see. While we probably won't be able to create a glow-in-the-dark dental van that can fly, this was a pivotal first step in designing a successful school dental program that will improve health outcomes for Victorian children. Today, we will also be sharing a video presentation by Professor Jan Clarkson, Director of the Scottish Dental Clinical Effectiveness Program, who will share her advice on how we can deliver a school dental program that improves health outcomes. Amongst other things, Jan will share evidence from the FICTION trial, which included the importance of looking at the client experience in terms of engagement, co-production, behaviour modification and trust. Jan will also give us some insights into her program's approach to caries management, behaviour change and the integration of fluoride varnish into their school dental program. Today we are absolutely honoured to also be featuring presentations from Professor Christabel Saunders from the University of Western Australia and Professor Jörg Eberhard from the University of Sydney, along with Louise McKinley from Safer Care Victoria and Dr Ruth Heredia from Access Community Health. Closing today's program will be esteemed health economist and health services manager Dr Stephen Duckett from the Grattan Institute. Last month, as many of you know, Dr Duckett, along with Matt Cowgill and Hal Swearenson, authored a report advocating for universal dental care scheme for Australia. The report found that 2 million Australians who required dental care in the past year either didn't get it or delayed getting it because of cost. And the poor and disadvantaged are most likely to miss out on that care. We look forward to hearing more about the case for universal dental care from Dr Duckett, as this has long been a hot topic on the health agenda. So on that note, I'm sure you've heard enough from me already, and I hope that today gives you an opportunity to reassess the way we do things, to be inspired by new ideas, to walk away feeling motivated, to play your part in transforming oral health care in Victoria, backed by evidence always. Thank you to everyone who has made today happen, and thank you to everyone working in the public oral health sector for your dedication and commitment to improving the health of the Victorian population. Enjoy the conference. Thank you.